Hi, my name is Dana Heitzenrater, and today I'll be presenting my teaching project for nursing informatics. And the subject of my teaching project will be to assist family and caregivers to identify common causes of increased confusion and agitation with individuals with dementia. And I'll be providing some instruction on managing these issues as well. The three main teaching points that we'll be addressing today will be identifying factors that cause increased confusion and agitation in those with dementia. We'll discuss and demonstrate actions that should be avoided when you're caring for someone with dementia, and we'll also discuss and demonstrate approaches when confusion and agitation occur. So to begin, we'll discuss the factors that increase confusion and agitation. One of the first things that I'd like to talk about are sensory deficits, and those would be when individuals have impaired hearing, impaired vision, and we want to make sure that we're providing them with their assistive devices such as their glasses or their hearing aids. In providing these, we want to make sure that the glasses are free of any debris and they're clean. And they also, with the hearing aids, that we have fresh batteries in so that we make sure that either one of these are giving the best sensory perception possible. Being able to interpret our environment will help us to be able to understand as a person with dementia our surroundings and be able to interpret the stimulation that's coming to us. Another thing that can cause increased confusion and agitation is overstimulation from large crowds or excessive noises. And another thing that can also increase confusion and agitation would be a lack of consistent environment or consistent routine. Some actions that you want to avoid when caring for an individual with dementia would be you want to avoid abrupt movements, and that would be making quick turns, doing something that would startle the individual that you're caring for. You want to avoid asking complex questions. In doing that, it can be very overwhelming to a person with dementia, and we want to make sure that we're breaking things down into simple, understandable segments so that we're not causing overstimulation that can lead to confusion or agitation. When communicating, you want to avoid walking or moving about because, again, this can be distracting to an individual with dementia. We want to make sure that we're avoiding any types of these things that, again, are providing more stimulation than necessary for that person to interpret their surroundings. As far as we've previously discussed, overstimulating environments, what we want to avoid in those situations are large crowds of people, loud noises. Again, all of these things clustered together can really cause some agitation and confusion because a person with dementia is not able to sort through all of these different stimulations, and it becomes a sensory overload and very overwhelming to that individual. So again, we want to make sure that we avoid those circumstances as much as possible. We will also want to avoid distressing reorientation, and that is a situation where many times an individual with dementia will revert to their past. They may be looking for their schoolmates, their parents, and are looking to go home from school. We want to try to meet them in their present reality, and if we do that, we can cause more distress if we try to provide reorientation indicating that their parents have passed away. That can cause a significant amount of emotional distress for that individual, so we want to avoid that at all costs. As far as approaches that we want to employ to assist with managing agitation and confusion, again, we want to provide the assistive devices that we discussed earlier, such as glasses and hearing aids, to make sure that they can interpret their sensory environment appropriately. We want to make direct eye contact with a smile with an individual with dementia to make sure that we're providing them with reassurance that they have someone that they can freely speak with. We also want to speak clearly and allow that individual to have time to comprehend the information that we're presenting to them, and provide those again in simple sequential steps and not overwhelming with a lot of heavy questioning. Make it simple, give 1 to 2 choices, and allow that person the opportunity to make those decisions independently as much as possible. We want to approach an individual that has dementia from front facing, and we want to do that in a calm manner. We want to avoid approaching them from behind because, again, this can be startling and actually increase those confusion and agitation situations. We want to utilize personal items such as a memory book that have personal pictures from their past that can provide some pleasant reorientation and direction and spark some pleasant conversation from their long-term memories when a person is having agitated or confused moments. This is something that, again, reassures them and provides them a feeling of safety and security from something that they're able to recognize from their past. At this point in time, I would like to thank you for viewing my presentation and would like to ask if there are any questions from the information that I've provided you with today.
No.
Okay. I would like to thank everybody very much for viewing this presentation, and I hope that it's helpful information when you're caring for someone with dementia. Thank you.